San Francisco says it has hit its peak in the COVID-19 Omicron surge. So what about the rest of California and specifically us here in San Diego? Good evening. Thanks for joining us. I'm Marcella Lee.
I'm Carlo Cicchetto. San Francisco's mayor is now asking residents to stay cautious with their activities and wear masks through the next several weeks, despite being exempt from wearing masks a little over a month ago. CBS 8's Kirsten Holmes talked with doctors about the surge, where they say we are right now and what happens next.
Kirsten joins us live now with all of those details. Kirsten?
Yeah, you know, hearing that we've hit our COVID-19 peak, or the surge peak, that is, probably is good news to a lot of people who are probably getting tired of the changing COVID-19 guidelines. But the doctors we talked to say that it is only slightly good news because we still have a lot of work to do when it comes to wearing masks and getting folks vaccinated, not only here in the U.S., but all across the globe.
This variant came from South Africa, but only 24% of them, the country was vaccinated. That is extremely low. There might be other variants that we might not be aware of because of the lack of access to the vaccine.
And that's why Dr. Argentina Servant says we can't let our guards down against COVID-19 despite hitting our peak in the Omicron surge. As of January 20th, 78 firefighters, 7 lifeguards, and 5 civilians from the city's fire and rescue department were out because of COVID. That's down from 129 firefighters, 12 lifeguards, and 12 civilians on January 13th. As quickly as it started, doctors say cases of the COVID-19 Omicron surge may decline.
And now it's burned through most of the susceptible population, and I think we're about to hit the downslide.
But Dr. Davey Smith, chief of infectious diseases at UCSD, says this isn't cause for a real celebration yet.
That doesn't mean it's over. It's just the end of the beginning, or maybe the middle, or wherever. We still have a few more weeks of pretty rough time, I think. Still have outbreaks every now and then, and we'll probably have surges every now and then, even if there is no new variant.
Dr. Argentina Servant agrees. She says the data points to hitting our peak, but there's still work to be done to get shots in the arms of the unvaccinated.
Even though we are seeing an increase in the number of breakthrough cases, the vaccines are still being effective because we're not seeing the same number of hospitalizations that we saw when we had the first wave.
There were signs of the painful peak hitting in other parts of the U.S. too. In Oklahoma, off-duty police officers stepping in to teach. In New Mexico, the National Guard doing the same as schools there are down nearly 1,000 substitute teachers. Dr. Smith says, despite hitting our peak, we won't be out of the woods for a while.
We're never going to have enough immunity to get it completely out of the population. It will continue to circulate, and it will continue to have these waves.
Now, as we all pull through this pandemic together, one of the biggest components of that pulling through is getting vaccinated. Now, the FDA is expected to review vaccines for kids under the age of 5 as early as next month. And I got to tell you this, sources say preliminary data shows that kids 2 to 4 years old will need likely 3 doses for full protection.